Welcome to the topic, Drugs for Neoplasia or Cancer, Part 1. So cancer is characterized by the rapid, uncontrolled growth of the cells, and it results from the damage to the genes controlling the cell growth, and it damages the cells that are no longer responsive to the normal chemical signals checking their growth, and they lose their normal functions, divide rapidly, and invade the surrounding cells. These are the normal cells that you can see, the blue in color. These are the cancerous cells. So many cells that continue to grow and divide, and sometimes there occurs the variations in size and shapes in cells. The nucleus that is larger and darker than normal can happen, and an abnormal number of chromosomes arranged in a disorganized fashion can occur, and a cluster of the cells without a boundary can also cause the cancer. So this is metastasis. Nothing but the abnormal cells often travel to the distant sites where they populate the new tumors. This is showing the invasion and the metastasis by the cancer cells. We can see in the breast cancer, it's a primary invasive cancer. Then it's a motile cancer cells, it's moving out. It moved to the lymphatic ducts, it goes to the blood vessels. And these cancer cells are traveling to distant sites, like they can metastasize the brain, they can go to the lung, and they can metastasize. That's how it's metastasizing by the cancer cells. So this is a tumor. It's a swelling, abnormal enlargement, or the mass. It is also called as neoplasm. The oma, it suffixes the tumor at the end. It can be benign at the start, and when it is too much, it becomes malignant. So this is kind of a benign tumor which grows slowly but do not metastasize. They rarely require the drug treatment, and they do not kill the patients. It may cause the pressure on the nerves, blood vessels, or other tissues. When we talk about the malignant tumors, so they are really called as the cancer. This is a disease that grows rapidly worse, becomes resistant to the treatment, and normally results in death. Two major divisions of the malignant neoplasms are the carcinomas and the sarcomas. Other types of the malignant tumors include the cancer of the blood-flowing cells in the bone marrow, which is called as leukemia, which can be a lymphoma, which is a lymphatic tissue. And if it affects the central nervous system, they are called as the gliomas. So the cause of the cancer can be chemical, physical, or biological. Like if it's a physical cause, might be ultraviolet and the ionizing radiations. If it's biological, it means bacteria, viruses, and parasites. If it's a chemical, then it's an arsenic, alcohol, or component of the tobacco smoke. All these are the causes, like asbestos can be, the tobacco can cause the cancer, but the nicotine is a life savior. We have the benzene and the asbestos. So the chemical causes, like the chemicals in tobacco smoke, are responsible for about 1/3 of all cancers in Canada. Asbestos here and the benzene down, they have been associated with the higher incidence of the cancer in the workplace, and the site of cancer may be distant from the site of exposure. Another causes can be the radiation, which can directly acting onto the DNA and damaging it, or they are indirectly acting onto the DNA and damaging it. If it's the sun, that is the UV protection, we use the sunscreens that can protect, but it is low, but extremely. We need sunscreen, sunshades, hat, shades, and indoor from 10 a.m. to 4 p.m. It should be recommended. So these are the physical factors which the exposure to the large amount of X-rays is associated with the high risk of the leukemia. And the ultraviolet light from the sun is a known cause of the skin cancer. Then we have biological causes, like viruses can cause the cancer, and 15% of all the human cancers, they are from there. Examples like herpes simplex viruses type 1 and 2, Epstein-Barr virus, human papilloma virus, HPV, cytomegalovirus, and human T lymphotropic viruses. So what are the causes of cancer? The factors that suppress the immune system, like HIV or the drugs given after the transplant surgery, may encourage the growth of the cancer cells, and the genetic component is the another cause, which in the certain genes predispose the condition. So cancer risk factors can be alcohol, excess body weight, genetics, sun exposure, radiations, unhealthy food, age, and tobacco smoking. If the lung cancer is, the main risk factors are smoking, genetics, age, radiation exposure, occupation that working into the X-ray or a UV radiations, radon gas, pollution outside. It can be because of family history and if you're working close to the asbestos factory. So being overweight can also cause the 13 types of the cancers. The larger circles, they're indicating the cancers with more UK cases linked to being overweight or obese. And the number of the linked cases are currently being calculated and will be available. So meningioma, a type of the brain tumor. A thyroid, it can be esophagus, breast after menopause, liver, upper stomach, gallbladder, pancreas, kidney, bowel, ovarian cancer, womb, and the myeloma, which is a type of a blood cancer. What causes the genetic changes? Heredity can cause, UV radiations, working in chemicals, cells are dividing in your body, the smoking can cause genetically inside you, and the viruses invasion can also cause the genetic changes. Then in a man and a woman, there are more chances of having what type of the carcinomas? They are thyroid gland for the woman, breast, gallbladder, ovaries, and endometrium. They have more chances of these kinds of the cancers. And the man, it can has adenocarcinoma of the esophagus, multiple myeloma, hepatocellular, renal, pancreas, colon and rectum, and the prostate. So the personal risk of the cancer may be lowered actually by the number of lifestyle factors, and these lifestyle changes includes eliminate the tobacco use and exposure to the secondhand tobacco smoke. You should maintain a healthy diet, low in fat and high in the fresh vegetables and fruit. Choose most of the foods from the plant sources, increase the fiber in the diet, and exercise regularly and keep the body weight within the optimum guidelines. Other than that, self-examine your body monthly for abnormal lumps and the skin lesions. Avoid the chronic or prolonged exposure to the direct sunlight and wear the protective clothing or sunscreen. For women, undergo regular mammography according to the schedule recommended by your healthcare provider. For men, receive the prostate screening as recommended by your healthcare provider. Receive the screening colonoscopy as recommended by your healthcare provider. So for women who are sexually active or have reached the age 18 years, they should undergo the annual pap test and the pelvic examination. For the girls who receive the HPV vaccine according to the schedule recommended by the Centers for the Disease Control and Prevention. So when we say healthy lifestyle, just a quick review: quit smoking, alcohol and tobacco, healthy and balanced diet, maintain healthy weight, exercise regular, protection from the sun, fight against infections, regular checkups and the screening, and sleep well. Other ways to reduce your cancer risk: do not smoke or use any form of tobacco, make your home smoke-free, enjoy a healthy diet, breastfeeding reduces the mother's cancer risk, vaccinate your children against hepatitis B and HPV, avoid too much sun, use the sun protection, reduce indoor and outdoor air pollution, be physically active, limit alcohol intake, and take part in the organized cancer screening programs. So this is recommended by the World Health Organization. Thanks for watching.